So we're going to be talking today about the ancillary products in the Medicare market. And the reason that we want to talk about these things in the light that we're going to be talking about them is that economics and economic forecasts are changing for the future. I imagine that most of you are aware of the problems with the supply chain. Now that things cannot go through the Panama Canal and cannot go through the Suez Canal, some of the countries are having difficult times with things. More people are retiring this year than ever in the history of the world, especially, well, in the United States, a lot of people are retiring. And Bob is going to talk to you at the end of this about some of the economic forecasts that are coming out of CMS and what the implications are. And those implications are going to suggest that a number of your clients are going to be more interested in products where there is a smaller predictable cost rather than in paying no cost and having a large emergency that occurs as incomes decline over the next little while, as Bob is going to be pointing out to you. You are going to feel my slant toward talking to you about the group ancillary products, and that is because people who are over 65, who are 65 and older, are going to continue working as the economy continues to give way to economic pressures. We're going to see people who continue to work longer after they turn 65, and all of that's going to have an effect on how you do marketing, how you get into people, how you talk to people. So I'm going to encourage you to read between the lines here, and maybe it's not so subtle as I make it out there, but read between the lines and start thinking about how you can apply some of these ideas around ancillary to opening up new channels for your marketing. We are going to be talking about some things that are obvious to you and that everybody already knows. Most of the names that I see here have been in the industry for quite a while. So there's going to be very little new that we can say to you about traditional ancillary. But there are going to be things that we hope that you begin to consider regarding group ancillary. So I'm going to start out with one of those things that is really common to all of you, which is, what does the term ancillary mean? And that is that it is a supporting function. It's absolutely necessary in many instances. For example, food services in a hospital is ancillary to the treatments that are going on in the hospital, but the food is absolutely necessary for the residents who are there. So food is an ancillary product. And what when the insurance companies who produce ancillary products call it ancillary, they're trying to encourage you to see it as important. In many cases, it may not be necessary the way food is, but it can be good for the economic health or financial health of your clients. So here's what I want you to really think about, and that is that there are two types of ancillary products. There are the ancillary plans that are the individual ones that you are all familiar with, right? Okay. Said, welcome back. I hope you can see now. So what I'd like you to think about is the individual plans, but I'd also like you to think about the group plans. And I'm going to encourage you to start considering how you change your marketing. So the Medicare beneficiaries who are aging in are going to continue working. So I'm over 65. I still work. Nancy's over 65. She still works. Bob's over 65. He still works. That means that you, in order to get a hold of these people, you're going to have to find a way into companies' benefits departments. And if you're going to find a way into your company's benefits departments, that means that you need to find something compelling to say to them so that they want to listen to you. And that means that you're going to have to be able to talk about group plans and benefits that are interesting to them. And so this is a first step in that particular direction. Okay, so by the way, we're going pretty fast. You can jump in and you can ask questions, but we will be moving fast just because we're going to stick on some economic stuff at the end. I don't think that this list of ancillary products is going to surprise anybody. These are the traditional ones. I sort of put hospital indemnity plans up there because as far as Stonehill can tell, that is the ancillary product that is sold most often and most easily. Dental, vision, and hearing, they have been embedded into the supplemental benefits of many of the Medicare Advantage plans. And so the standalone ancillary products are not getting, seeing a lot of movement, a lot of production. But economic forecasts suggest that there's going to be pressure on the carriers. There already is pressure on the carriers. It started fourth quarter last year. And it continues into first quarter this year, where the capitation rate paid by CMS to insurance companies is beginning to go down. So they're making 2% less per head this year than they did in 2023. There are other trends that are going to threaten those supplemental benefits, dental, vision, hearing aids, and things like that. And so you need to start being aware of these things. You need to be aware of what's going on and what's going to be in your individual clients' interest. But I think that you're going to want to start paying attention to news articles and to and start doing research on group benefits. Let me just say something here. So you can see by colors, I've divided the ancillary products into three categories. Those that are in purple, you can talk to people about if you have a generic SOA. So they are health plans. And you can talk about health plans to people at the same time that you're talking about MAs or PDPs. Those that are in red, you cannot talk about. So you even have a scope of appointment that's broad as you can make it, and it's been signed. You cannot talk about these things. You have to put that off to a second meeting. Those that are in teal are sort of in between. So I went out yesterday and I tried to find where something or some authoritative body said that you could talk about these things or that you could not talk about these things. And I could not find anything that was authoritative that said, clearly either way that you could or could not. And so you could make a case for talking about these things from a legal perspective, but I think from a practical perspective, you probably do not want to talk about these at the same time you're talking about MAs and PDs, because MAs and PDs require your full attention, and each of these requires your full attention. So it's not a legal prohibition to talk about these things at the same time that you're talking about MA and PDP, but it's more of a practical guideline that you probably don't want to talk about these things. Now, one of the things you could do, and I just want to mention this, right now, and I did try to verify this yesterday. I wasn't able to verify it as much as I wanted to, but I do not believe that CMS is requiring scopes of appointment to be input into HPMS, their system. That means technically that agents are allowed to create their own scopes of appointment. You'd want to do it according to the guidelines and everything like that, but you're allowed to create your own scopes of appointment. I would imagine, and I think I would fall into this camp myself, I would imagine that I would feel much safer using an SOA that had been produced by a carrier, and I would feel much safer using an SOA that had a CMS approval date on it, even if it was several years old. But I just wanted you to know, as you are starting to think about new ways of marketing, as the economy changes and the way that you get to people who are aging in changes, that you do have a little bit of flexibility and latitude that's being given to you, even as different avenues and flexibility are being taken away from you.
Annuities or ancillary?
Now, say again.
Whoops.
So I think the question was, do you have to have an SOA for an ancillary? No, you don't. You don't have to have an SOA for an ancillary, but you do need to have an SOA to talk about ancillary if you're talking about MAs and PDPs. I hope that makes sense. Here's some reasons that agents should take ancillary plans seriously. I know that we have talked with agents in the past who say that they don't want to take ancillary seriously, that is just a complexity that they think that they don't want to be bothered with. So again, I am going to split up these ancillary products into two columns. The column on the left is for group, and the column on the right is for individual plans. And I'd like to say that if you're going to insist on not taking ancillary plans seriously, that you should probably decide not to take individual plans seriously, but that you should probably figure out how to take group plans seriously, which may require a change in some of your presuppositions, right? I break down the left column, group plans, into two sets of value. The top one, group plans, and you can see that I did not fill this out too much, but it's the benefits of selling group plans to the individual healthcare agent or Medicare agent. And so I just mentioned here that it's a way to break into a primary source of future leads. And I think that you are going to be able to fill out the rest of the benefits yourself. I could mention just a few of them, which are higher value sales. If you can sell into multiple people by getting into a company, you're obviously going to make more compensation than one-off sales, things like that, right? But I think that you can figure those things out. So, okay, wouldn't accident supplements be considered ancillary? Yes, they would. So this second category is on group plans, is how you offer value to companies, and I think this is a much more important thing for you to be wrapping your head around, right? So I'm just going to go through these things quickly because I am, as I tend to do, talking too much. You want to offer plans that raise the value of company in the eyes of older workers. And if you need if you need examples of that, I've got some stories that I'm not going to take time here. But if you get in and you offer companies group plans, you can actually increase the value of the company in the eyes of the older workers, which means that the older workers are going to stick around longer. And that's something that companies are becoming more and more interested in as they become more distrustful of the work ethic of, say, Gen Zers and some of the people who were supposed to be replacing the baby boomers as they retire. So if you can find a compelling story, it may be a good in your marketing or your direct sales or whatever it is that you're going to be doing. I'd like to say that a lot of the carriers out there are also aware of this group opportunity. A lot of them are now offering group ancillary products. And I would imagine that you would be able to get case studies from carriers. And I'd like to suggest that you try to develop a relationship with the carrier. The starting place would be the carrier rep. And I'm going to suggest that you would want to focus with one or two carriers, and you'd want to develop a strong relationship with the department that sells ancillary products, and sort of nurture it, sort of nurse it along as a strategic partnership of yours. In other words, I think that you should do that directly rather than having Stonehill step in and do that, because that's part of your marketing. We're here certainly to support your marketing and the regulations and everything, but marketing is how you differentiate your company from all the other companies that are out there. And even though if you work with us, we're not going to share any of your corporate secrets with anybody else, we would still like to encourage you to develop those things so that you understand them and you can grow and nurture them. We think that you will be able to start gathering, especially with artificial intelligence, data and insights on senior employees that you will be able to share with them. These HR people are not going to be looking at the same things that you are. They've got other things to be looking at. So if you make it very easy for them to understand certain facts about their senior employees and quick ways to verify that, and we'll be talking about that with artificial intelligence as well, you could raise your credibility in the eyes of these HR departments. Partner with carriers on materials. Of course, they all do that, but you may be able to get to a point where if you have a certain number of cells going through, you may be able to persuade them to co-op with you or to even generate one-off marketing materials for you. And then flexible packages of groups that are together, of packages that are together. I'm thinking of, for example, of a group MSA with some short-term care or something like that. Okay. I'm not going to spend too much time on this because I've already covered this stuff, but I would like to say that one of the things that you're probably looking at in the economy that's going to be coming is that people are going to become more averse to large unexpected expenses. And so you will be able to present a case to them that an ancillary product, say for cancer, heart attack, or stroke, or other critical illness, would be a good financial bet. And notice this is something where it has to be your client who makes that decision. I want to pay a little bit that I can't get back to prevent a large incident from happening, or do I not want to pay anything and then potentially get hit with a large expense down the road? And it seems to me that if you are an ethical agent, you want to give them the opportunity to make that decision rather than assuming that you know best what decision that they would make. Again, we've talked about this quite a bit, about the reasons here, about the changing economics, about the changing demographics as the baby boomers age in. But the elderly population is growing, and it's growing in proportion to the other demographic sectors that are younger than us, that are supposed to be supporting us the way that we supported people. But and I would imagine that most of you know this, the baby boomers is the largest generation. And what was happening up to the time of the baby boomers, the segment of the population has these names, baby boomer, millennials, and everything, that was growing, and it maximized the baby boomers. And then after baby boomers, it starts to shrink, right? We get birth control in, we get people moving to the city. People are moving off the farms. It's no longer a benefit to have children. Now it's an expense. People can't afford to have lots of children. And so we're seeing the generation shrink. And we still have a financial model in place that is based on the notion that the younger generation is always going to be larger than the preceding generation, so that the working generation is always going to be able to pay taxes to support the smaller generation that is in retirement, and that model is broken now. So we just need to keep that in mind. Again, here, what we want to do is we want to convert expensive emergency procedures into less expensive, predictable payments. We're also trying to change the behavior by incentivizing people to do what they would otherwise not do because of cost and pain, right? Those go to the dentist, go to the ophthalmologist, go to the audiologist, talk to a financial advisor, do the things that they don't normally want to do or that they're going to procrastinate doing. So you could actually see ancillary as a way to nudge people, and you have to do it diplomatically, as all of you know, because you're salespeople. You have to do it diplomatically, but if you do it diplomatically, they may accept it because you're nudging them to do what they know that they should do, but they dread doing and just don't do. If you do this, also what you're going to do is you're going to reduce the stress levels in crisis. And this is actually a benefit that I was asking AI what the benefits are of offering ancillary coverage. And one of the things that it said to me was that if you can do that, because what we see that the technical and the scientific advancements are accelerating. And if you can get people to accept, to buy in, to adopt a new product, what that does is that brings the price down faster, which makes the distribution easier. And I thought that was pretty good, so I included it here.
All right. Hope everyone can hear. Thanks for being here. I'm going to move kind of fast, so if you have a question, make sure you answer it. So how are ancillary plans advantageous to the beneficiary? And, we're talking about products and plans that are not covered by original Medicare and some of the holes that are in MA products. Most of these benefits are paid out in a cash benefit, like the cancer, heart attack, and stroke. Many of the carriers that offer those ancillary plans pay the benefit out in cash. One of the big ones I get asked all the time is about home health care. LTC is not covered under Medicare, and I'm sure those of you who have been in the market for any length of time have had a phone call from a client who asks about long-term care or nursing home care. That's why it's important that you talk about home health care needs. Other senior needs, one is final expense, life insurance. If you get into that market, you want to make sure that you go, your compensation, you are paid as earned. There seems to be about a 40% drop off or cancellation on final expense. If you go paid, your compensation is paid as earned, you won't have to worry about big chargebacks. We have annuities listed as one of the ancillary products. If you're with a client, I've had clients ask me if I do annuities, and the reality of it is I don't feel comfortable talking about annuities, but we have experts associated with Stonehill that will help you with annuities. Now, if they come in and help you with a specific client, you can expect to split the commission with them for their time. Ancillary products make expenses more predictable, specifically hospital indemnity. And we'll get into that a little bit later, how usage utilization is going up. Getting cutting edge coverage beyond standard care, such as some carriers offer DNA sequencing for their cancer care products so that you can have a scientific approach to why they should have cancer care. Next slide, Doug. What is number one killer of women in America? Remember this, hint, hint, remember this, is heart attack.
Oh, wow.
Okay, which carriers offer ancillary plans? Boy, there are a lot of them, a lot more than what we have listed on this slide. One thing you want to be aware of is Medico has changed their name to Wallaby. And whenever I see that, I think of Wallaby, and I'm thinking, what are these guys from Australia? Anyway, there are a zillion carriers offering ancillary care. If you have questions, you can give us a call at Stonehill, and we can give you some insights. Some of the most popular ones are the ones that are listed on this slide. Next slide, Doug. What to look for in an ancillary product? We got several things on here. A company with a high rating.
Bob, do you mind? Someone raised her hand. Cami raised her hand here.
Okay, what's the question, Cami?
Sorry, that was by mistake.
It was the infamous butt call, Cami. Is that what you're trying to tell us?
Yes, my phone slipped out of my hand and accidentally hit that button. Sorry.
What to look for in an ancillary product? A company with a high rating. A company with a reputable brand. A company with a diverse line of products. A company with good customer service. I can't emphasize that bullet point enough. Good customer service. Boy, to me, that's right at the top of the list. A company with competitive rates. Next slide, Doug. Question. Please enter the correct answer in the chat box. Here we go. What should you look for when you are determining which ancillary plans are most beneficial? 1, plans offering the lowest monthly premium without regard for scope of benefits. Plans that fill important coverage gaps and address a client's specific needs cost effectively. Boy, that's got a thumbs up. A company with a marginal ratings. A company with the widest range of services regardless of a premium. All right, we all know what the answer is. It's number 2. But remember this. Make sure you remember this one. Next slide, Doug. How important is ancillary coverage? According to the American Journal of Medicine recent study shows that 42% of all patients lose all their savings in 2 years due to treatment. 62% of cancer patients are in debt. Now, the question that comes to my mind is, what about the max out of pocket? If you're on an MA, you've got that safety net. It's important that you review that. I get asked that many times in front of a client. Well, isn't there a safety net? Yeah, the safety net is the max out of pocket. So that's something you should consider when you look at the numbers on this slide. Next slide. Remember this for later. Hint, hint, hint. It takes 2 years for 42% of cancer patients to lose all their savings due to treatment costs. Now remember this slide. 42% lose their thing. Go ahead, Doug. Doug, are you there? Oh, I think Doug, there he goes.
Can you see it?
Yep. You're up.
Oh, sorry. That's what that meant. I was so busy clicking that I. Okay. Determining the best plan for your client. This one was interesting. Again, and some of these things are a little bit different than what you might have looked at in the past. But I'm just going to go through these things really quickly. So determining which features are relevant and important to your client. We'd like to suggest that you sit down and you, before you even really decide which product you think is going to be the best, you determine on your own what an ideal product, what features an ideal product would offer, and which features they would not offer. And then you would use that to help you decide which is the best plan for your client. Which plan design comes closest at the best price to that thing that you just created? How are the available plans differentiated from each other? And then this is a big one. It turns out that this is one of the major reasons that people don't like stuff, both agents and their beneficiaries. How much learning must your client suffer in order to use this particular product? So if you look at that and you see that some companies do a better job at educating their clients, that should probably guide your decision to some degree. What does their post-sales support look like? Bob mentioned this earlier. What does the provider network look like? And what is the value perception? And again, I am going to say, what is the value perception, especially of the group ancillary plans, to the HR or benefits department that you're going to be going into? We're going to be looking here at a few of the benefits of just a few of the ancillary plans. Again, this one is in some ways the granddaddy. It's the one that helps everybody. When Stonehill can persuade agents that they could nearly double their income by just finding out if someone would be interested in a hospital indemnity plan, this is usually the plan that's the easiest to incorporate into their sales presentation. It pays cash. So if you are admitted to the hospital or even for observation, those things have co-payments or cost sharing associated with it, and this will compensate for that. Cancer plans. These things provide extra cash for unexpected travel. So one of the things that Bob raised a second ago is that you do have your maximum out of pocket on the Medicare Advantage plans, and yet people are running out of their savings. And that is that the reason for this is, and we're starting to run into this with respect to the negotiations between provider networks and hospitals, insurance companies, and that is the rate of denials at requests for pre-authorization is going up. And that means people are having to pay for important procedures and treatments out of pocket. And they're having to try, and lots of them feel motivated or incentivized to try procedures that aren't tried and true, which are the only kind that the insurance companies come up with. And so here are some of the reasons that you would want extra cash for that, in addition to those that I mentioned before. Okay, short-term care. This is one that we find our agents are asked quite a bit, are asked quite often. And most of the time, the question is actually long-term care. Short-term care just came into the market several years ago as long-term care started to fall apart, as the government started to say, you need to increase your reserves as insurance carriers if you're going to be offering long-term care. And most of the carriers decided that the reserving requirements were just unreasonable, and so they exited the market. And yet there was still a demand, and there was still need. So these carriers came out with what they call short-term care, Short-term care means that you cannot be in a nursing facility for more than 360 days. Now, some of these have renewable benefits. So you go in for 360 days, and then you come out for a couple of weeks, and then you go back in for another 360 days. But they are not, you don't put somebody into a nursing facility and leave them there for decades. That just doesn't happen under the short-term care thing. It is intended to try to give family members breathing room to make tough decisions about what they're going to do with mom or dad. It does have lower monthly payments and better reserving requirements than traditional long-term care. Okay, so the reason that most agents are unwilling to think about offering ancillary products are twofold. They really like being able to offer a zero premium insurance plan, and when they are compared with property and casualty insurance companies who are always looking for money, it does help the Medicare agents to be able to offer a zero premium plan, and it makes the sell easier. But it also makes them so that they are reluctant to raise opportunities or to offer plans that do have a premium. The second thing is they have become pretty gifted. I don't know of any agent who says, if I get in front of a beneficiary and I'm able to do my presentation, most of them will not make a purchase. I would imagine that 99% of the agents, if they can get in front of someone and start talking to them, then they're going to be able to make a sale. And they've gotten very good at that. And so you start talking about incorporating language for short-term care or hospital indemnity or something like that. They feel awkward. They don't want to do it. And so these are just some bullet points to think about if you are interested in that, right? All of these things are just the beginning of something where you're going to have to do your own thinking. And by the way, this presentation is going to be posted out on an agent-only website called MedicarePlanDetails.com. And you can go out there and look at all the videos, and you can look at carrier supplies and everything that are out there easily. And you'll be able to go out and look at this next week when we post this, if you want to look at this. And I would hope that some of you do decide that you're going to want to start thinking more seriously about Medicare ancillary products, especially group ones. Your goal is probably, yeah, go ahead.
Doug, I'm sorry. Bill Turner has a comment in chat. I'm sorry.
I see it.
Okay.
Bill, I don't know anything about that. I would see a huge fight between NAIC and CMS, and I know that they've already gotten into several spats. And the National Association of Insurance Commissioners, the state insurance commissioners, think that CMS is intruding into their territory all the time. So that would be a good thing to keep an eye open for. I hope everybody can see Bill's comment there. So I think everyone's goal here is to not feel awkward, but to feel smooth as they bring things up. So I'd like to suggest that the way that you do that is that you develop a strong sense of confidence in your ability to do this smoothly with people. And the way you do that is with practice. That means you have to understand your existing presentation and figure out how to slide this in. And you can do that if you just sit down and maybe write out some things, write out how you transition from one to the next. You'd want to be, as you're working on your expressions, find those that are valuable and then practice presenting to a spouse or someone who will listen to you, or to your phone recorder or in a mirror. Find transitions from your current presentation to the ancillary presentations. You may want to, as you're talking to people, you'll get a sense of, do they need short-term care? Do they need hospital indemnity? And you'll want to decide on one or the other of those, or maybe both, and then figure out how to transition. And you may want to figure out how to ask questions that elicit questions from them that would give you a good segue. And you can actually do that. It just takes a little bit of effort to figure out how to ask questions, to get them to ask questions that give you the segue, to make it feel very natural to switch over to talking about an insurance product that does have a premium in the context of an insurance product that has a zero premium, and then have persuasive marketing materials. Okay, so just about done here. And then we're going to be moving on to Bob here. I just want to talk a little bit about a fiduciary duty. And the fiduciary duty that an insurance agent has is not quite as strong or legally binding as the fiduciary duty of, say, a financial planner. But I wanted to point out that a beneficiary, so we have Medicare beneficiaries, and they are the government's beneficiary, but they are also your beneficiary. And the opposite of a beneficiary is a fiduciary. And all of you do have a fiduciary duty. You are all fiduciaries. And so I'm going to suggest one of the things that you would like to do is figure out how to talk about ancillary in such a way that you feel smooth and confident, but also you're giving them the opportunity to tell you no, that you're not hurt when they tell you no, and that you know that you have fulfilled your fiduciary duty by giving them a choice and letting them make the decision about their future. There we go. Okay. So it's not quite over yet. We got two more things. One is that you're going to be receiving an email immediately following this CE. And we have gone 50 minutes, which is the requirement of this thing. You're going to have 3 questions when you get the email from Morgan. Include your name, your license number, and phone number. We need those things. We need to make sure those things are correct, because we need those things in order to report the credits into Circon. And then send all this stuff back to Stonehill. Okay, Bob, take it away.
All right.
Hey, Bob, before you go on, can I just talk to the client agents real fast?
Sure.
Okay, so I'm going to send out the questions. If you have not actually signed up for the link to this webinar, you're using maybe someone else's or anything like that, please go ahead and put your information into the link that was sent out so that I can know who you are. There are a couple people on here that I'm not sure I have their information for. Specifically, one that I noticed, the phone number ending in 37. I don't know who that one is, so I can't send you the link so I can't send you the questions if I don't know who you are. So if you haven't signed up and you would like credit for the CE and you want me to send you the questions, please do so, and then I can go ahead and send those out to you. Okay, I'm done.
Thanks, Morgan.
And Bob,
here's
do you mind if I ask Doug this? Doug, do you want to mention the new password for the Medicare plan details?
Oh, that's great. So the password for MedicarePlanDetails.com is Advantage with an uppercase A. So we just changed that. So thanks,
all right.
Nancy.
Great. Thanks, everyone, for attending. Just a little bit of a teaser. On March 15th, we're having a more in-depth discussion of AEP results and trends coming up. A couple of things. According to CMS, there was an unprecedented utilization spike during the 4th quarter of last year on Medicare, and they are mainly elective orthopedic. And again, I stress elective orthopedic and cardiac surgeries. Elective meaning it's not life-threatening. There was also a spike in short-stay admissions. Another thing, CVS or Aetna, aggressive marketing, benefit design really affected AEP results. I'll show those in a minute. We also lower CMS reimbursement to the carriers about 2%. That's putting pressure on the carriers going forward. CMS is increasing oversight of reimbursements and overpayments. So again, more pressure on the carriers. Next slide, Doug. Trends continued. MA still has long-term growth potential. We are at the peak. We've hit the peak of the baby boomer retirement age of 65. Right now, currently, MA has 54% of the Medicare market. CMS estimates that MA will have 60% share by 2030. It'll be approximately 70 million Medicare beneficiaries by 2030. More than half, this is one that shocked me that I saw in the research, was more than half of Medicare beneficiaries will live on less than $20,000 a year in today's dollars by 2030. Of course, they recognize inflation will take that number up, but in today's dollars, more than half of Medicare beneficiaries will have less than 20,000 in today's dollars, which is just, not that much higher than the federal poverty level. So MA supplemental benefits such as food, transportation, healthcare coordination, and value-based care will be critical components of MA in the future. Next slide, Doug. Trends continued. PDP memberships continue to decline. However, AEP retention was better than projected. Part D plans are moving to lower maximum out-of-pocket costs, resulting in significant changes in plan designs to conform with actuarial demand. So keep that in mind. That Part D is going to see a lot of changes. CMS is projecting considerable Part D lower membership by 2030. Next slide, Doug. Utilization outlook for 23 and 24. Inpatient utilization increased from fourth quarter 23, and it has continued in numbers. Preliminary numbers suggest that inpatient utilization has increased January and February of this year. This one was interesting to me. Industry average the medical loss ratio climbing from a mandated 85% to 89% this year, which means, let me decipher that for you. MA carriers are required to spend 85 cents of every dollar being reimbursed to them from CMS into benefits. That has gone up. Statistically, right now it's at 89% or 89 cents of every dollar is spent on benefits. They're forecasting that by the end of this year, that number will be 91.5 cents for every dollar is going into benefits. Medical loss ratios and CMS reduction in reimbursement rates represent significant pressures on carriers going into 2025 next year. I think we're going to see some changes. CVS Aetna growth was beyond their own projections. So it raises the sustainability question. Utilization projected to increase. It'll affect plan designs. COVID, RSV, and other respiratory vaccinations are decreasing in cost. So no pressure on plan designs going forward because of vaccinations. Some people, I've been asked that, how can they offer all these vaccinations for free? Costs are actually going down. This will improve health outcomes for seniors. Q4 utilization increase drove conflicts between carriers and providers networks on prior authorizations. We saw that. We all saw that with Aetna, and word on the street that United Healthcare has to renegotiate with University of Utah, and that is going to be interesting to see how that works. Next slide, Doug. Trends continued. There, CMS is projecting greater DSNP pressures on Medicare and Medicaid. Decline in senior incomes going forward will pressure plan designs and premiums. And here's the conflicting trends. They're seeing that seniors are working way past 65. That helps the economy on one hand, but the younger generation, Generation Z as they're called, a couple of things. Companies are finding it difficult to hire work ethic with that generation. The other thing we need to be aware is the demographic bomb. The demand by seniors on the economy is going to outpace the amount of money coming into Social Security. Next slide, Doug. Here's the last slide. This is Medicare Advantage 2024 AEP performance. At the top of the list, it shows United Healthcare grew by 1%. That was very distressing. That was way below the projected number by United Healthcare. Humana, a 2% increase. But the one that we really see a jump in is CVS Aetna Health Corporation. They had a 15% increase. Now, one thing I want to state is that I had neighbors. I live in an area that's Geezer. It's Geezerville where I live. I had neighbors telling me that they'd heard about that $1,200 reimbursement. Approach me. Can I come to your office? It was amazing to me how many people came out of their woodwork. Those are the three main carriers at the top of the list here in our market. Now, if you go down there, you'll see Cigna's on there. You'll see Kaiser Plan, but you'll see things that don't really pertain to us. That Cigna group is down about 7 or 8 slots there, 1% decrease in enrollment. Scan, 2%. We don't see Scan here in Utah. A big growth one was MHH Healthcare, 17% growth. Again, we don't see them here in Utah. Healthcare Service Corporation, 20% increase. But the one that jumps off the page is Devoted Health Incorporated. I don't know where they're at, but they had a 41% increase in their book. Feel free to look at this. Again, Doug is going to post it. And I'll close up by saying thank you so much. As you talk ancillary to your products to your clients, know your client, know your product, and have a plan. Thank you very much. Back to you, Doug.
Thank you. So that's it. We're going to stick around here. You can stick around and ask questions. And I am going to be posting these statistics out there on Medicare plan details. And there will be the recording out there as well if you want to look at that later. Again, MedicarePlanDetails.com. The password is Advantage. We have to have a password to keep the consumers out. It's only for Medicare, for health agents. So thank you very much.